qui va présenter sa motion. Jack Harris, off to you.
Thank you, Jagmeet. And I'm very excited today, of course, to begin debate on my motion M62 in the House of Commons. Calls for the government to create a dental care plan that would provide for those with family incomes of less than $90,000 a year as a first step toward a universal dental care plan for Canada. Now, you know, oral health is one of the most unequal aspects of health care in Canada, because most dental care isn't covered by public health insurance plans. You know, it was supposed to be part of healthcare from the beginning, but the commission studying this said that because of an acute shortage of dentists, that it was impractical to make it a part of a universal plan. So this is not an add-on. This is something that's very important to so many people. In fact, those with the highest levels of oral health problems are also those with the greatest difficulty accessing oral health care due to the cost. It's a part of healthcare that people have been denied for no good reason. It affects all other aspects of healthcare, including mental health and a sense of self-worth. If it's left untreated, poor dental hygiene is linked to many serious health conditions like cardiovascular disease, dementia, respiratory infections, diabetic complications. It's not an add-on to healthcare. It's a very important part of healthcare. Now, our plan would benefit nearly 7 million people in Canada who aren't currently covered by a dental plan and can't afford to pay out of their pocket. More than half of low-income Canadians would benefit. 1 in every 2 seniors over 60, 3 in 10 young adults, 1/4 of women, more than half of the residents of Newfoundland and Labrador, for example, with family incomes less than $70,000 or $90,000 would qualify for the program. You know, we've been calling on this for a very long time. But the situation is now more urgent than ever. You know, since the beginning of the pandemic, millions of Canadians have lost their jobs, and of course, millions of others didn't have it. And with it, their healthcare benefits, including dental care. It includes many low-wage earners who can't afford to pay for private healthcare insurance. We've seen emergency room health across the country feeling the full weight of COVID-19, yet every 9 minutes, for example, someone visits an emergency room in Ontario for dental pain when they really need is only to see a dentist. The estimated cost of these visits across Canada have been estimated as more than 150 million per year. And in fact, this is a sad add-on to this information. Recent research and study at McGill University found that those with poor oral hygiene are far more likely to experience more severe COVID-19 symptoms, which is pretty shocking. And patients with gum disease are 3.5 times more likely to be admitted to intensive care, 4.5 times more likely to require a ventilator, and almost 9 times more likely to die from COVID-19 compared to those without gum disease. So this is extremely important, even more so now during this COVID-19 crisis. Our plan is doable. It's something the government can put into place right now. A federal insurance plan that the provinces would administer. It's been fully costed by the Parliamentary Budget Officer, would have a very significant impact for those who are suffering the most from this pandemic. So time and time again, of course, we've seen the Liberals make vague promises to do something about dental care, but then nothing happens. And they've even voted against our proposal last February to give dental care to those who need it most. So it's really about choices and about the priorities for the Liberal government. So far, they've made other choices, and I think I'll pass this on to Jagmeet to talk a little bit more about that. But I'm imploring members of Parliament today, all members of Parliament today, each of whom, by the way, have access to an excellent healthcare benefits to the House of Commons, including dental care, to vote in favour of this motion. This is a problem we can fix, and we must. Thank you, Jagmeet. Over to you.
Thanks so much, Jack. Jack Harris just laid it out so well, and so many examples. And actually, I want to share a story that Jack told me when we first made this announcement. He shared with me how someone ran across the street and came up to him and said, "You know, I need this. This would make a difference in my life." I remember a similar situation after we announced that we wanted to bring in dental care. I met a woman in my office in Burnaby, and she had her hand over her mouth the entire time we spoke. And she said, "I'm too embarrassed of my teeth. I don't need a I don't need a handout. I want to be able to work. I just am too embarrassed to get out in public. I'm too embarrassed with my teeth. And they were in bad shape and she needed care. And it is absolutely not an add-on. It's something that's missing. Dental health, oral health is directly connected to your overall health. And it makes no sense at all that we have not included that into our healthcare system. So this would make a big difference. And we look at the Liberals' choices. They choose again and again to spend money, but to do it on the ultra rich. They continue to allow the wealthiest companies to use tax havens to hide their wealth. They continue to allow web giants to make profits off the backs of Canadians, but not pay their fair share here. And we have given them example after example and opportunity after opportunity to change their choices. We said, for example, why don't we actually move forward with pharmacare instead of just talking about it? They voted against pharmacare, voting in favor of big pharma and voting against people. They voted against getting rid of profit in long-term care. They voted against taxing the ultra rich. And here's another opportunity. We're saying, stop with your continual incessance in supporting the ultra rich. Let's support people and solve this problem. As Jack said, we could solve this right now. If the Liberal government wanted to, if Justin Trudeau wanted to, we could fix this right now. We are ready. We have a motion. We could support legislation. We actually proposed a solution, a quick solution in the Liberal proposal that would have cut taxes. We said, let's ensure that the richest pay their fair share. And if we did that, we can actually carve out enough money to pay for this program. It is very doable, very achievable, and we would immediately change the lives of millions of Canadians. This is something we have to do. We are dedicated to it. We're committed to it, and we want to see action. Liberals have talked a lot of talk. Let's back that up with a real concrete solution to a problem that we can fix. And I'm excited to stand in support, of course, of Jack Harris and our entire team that stands behind this idea. Let's make dental care a part of our universal healthcare system, starting with this first step and moving to universal dental care coverage for all. Donc, j'appuie énormément cette idée. L'idée d'avoir des soins dentaires, c'est essentiel. C'était toujours l'idée qu'on a proposé un système de santé qu'on inclut aussi la santé dentaire. Mais jusqu'à ce moment, c'est une grande inégalité qui existe. C'est directement l'impact des gens qui n'ont pas les moyens. Ils ne paient pas pour les soins dentaires. Donc, on peut régler ce problème. On a proposé une solution. Le gouvernement libéral a choisi de ne pas aider les gens à plusieurs reprises. Ils ont voté contre. Le projet de loi peut mettre en œuvre une assurance médicaments universelle et entièrement publique. Et ils ont aussi voté contre notre proposition d'avoir des soins dentaires. Donc, on peut le faire, on doit le faire. On exige le gouvernement libéral de nous appuyer pour appuyer les gens. So with that, thanks once again to Jack. Really, really honored to support this. And I want to pass it back to Nina, who will then take questions from the media. Merci infiniment. On est prêt pour vos questions. Je passe la parole à Nina.
Merci beaucoup. Thank you very much. So I would like to invite members of the media to please use the raise hand function at the bottom of the page to ask your question. J'aimerais aussi inviter les membres des médias d'utiliser la fonction lever la main au bas de la page pour poser votre question. We will go ahead and start with Chris Reynolds with the Canadian Press. Please go ahead.
Hi, thanks very much to both of you for taking time to answer our questions here. I had a question unrelated to dental care. So, Mr. Singh, Randall Garrison said in relation to military sexual misconduct issues that when you have a case of sexual misconduct, he said quite often it's women who are blamed for not taking their complaint to the right place, not following the right procedures, not doing the right thing. And in this case, he was referring to demands from the Conservatives that Chief of Staff to the Prime Minister, Katie Telford, step down due to the Jonathan Vance allegation. So, and then just in reply, forgive my long question here, Ms. Candice Bergen of the Tories responded in a tweet today that the NDP position on our motion is patronizing and sexist. To say women in power should not be held to the same account as a man in power is wrong. Their priority is propping up the Liberals and not standing up for women in the military. I was just hoping for a response on that accusation from the Conservatives.
Their accusation is ridiculous. So we have a situation right now where the Liberals clearly knew about this problem, and there's evidence that Conservatives knew about it. And the conservatives are worried about who is worse. Their entire fight is not about protecting women. They want to find who to blame, and they want to say who is worse, were the conservatives worse or the liberals worse. They're both bad. They both failed women. And what we want right now is a solution. This conservative proposal is not going to make women safer. How is it going to make a woman safer right now in the military? How is it going to make a woman safer that's in the Canadian forces? It's not. And the liberals' proposal to do another report when they sat on the same idea in 2015, a justice did a report that laid out clear steps that need to be taken, and they did nothing. So neither the liberals, their proposal to do a report, is going to do anything to make women safer right now, nor will this conservative motion do anything to concretely make women safer. What we need to see is immediate action, that women, when they bring forward a complaint, it is followed up. There is a follow-up. There is action taken. If a complaint makes it to the desk of the prime minister or the defense minister, there needs to be action. There needs to be independence. You shouldn't have to go up the chain of command if you're going to raise a concern about someone that's superior to you. In the military, we need to have independence when it comes to bringing forward these types of concerns. So that's the type of step we want to see happen. We want to see a clear acknowledgement of the problem, and then clear steps to making sure women are listened to, complaints are followed up with, there's an independent process. That is actually taking care of women, not this attacking, who's to blame, making one person resign. That's not going to fix the situation for women. It's the prime minister that's to blame, and it's the defense minister that's to blame. That's the person who's responsible. And then that's where the responsibility and the accountability should stand. And we want to see actions that protect women.
Thank you for that. Second question on some witnesses to parliamentary committees, like the Ethics Committee, which is looking into MindGeek and Pornhub, for example, have complained recently that they haven't been treated with respect and with a sort of a trauma-informed approach to their remarks when coming before these parliamentary committees. It's obviously a very sensitive subject if it involves exploitive videos, for example, or abuse. So I'm wondering what your suggestion might be as to how to handle situations where folks, especially women who have been through abusive or traumatic events, particularly sexual incidents, should be treated and welcomed in the context of a parliamentary committee, with all its rigid rules, procedural restrictions, and so forth.
I appreciate the question. We certainly need to do a better job of making sure there is that sensitivity and understanding when it comes to questions that are being posed, that are trauma-informed, that do understand the sensitivity, the difficulty, and how hard it is to talk about experiences. We need to absolutely do a better job of making sure that type of awareness and that type of training is available, so that members of parliament can still do their job, but do it in a way that respects the vulnerability and the challenges faced by someone who's coming forward with particularly violence or exploitation that they've experienced that is sexual in nature. That is absolutely something important that we should do.
Thank you very much. Merci beaucoup. Just a reminder for members of the media to please use the raise hand function to ask your question, and also please identify which media you are representing and who you would like to answer your question. So next I have Beth Penny. Please go ahead.
Hi there. My question is for Mr. Harris. I'm with NTV News in Newfoundland and Labrador. I just wanted to ask what you've heard from people in Newfoundland and Labrador about the need for this federal public dental care plan.
Just hit unmute there.
All right, I got it. Well, we've heard a lot. I mean, this feedback has been tremendous, unbelievable, really. A lot of people who are responding to this, but with personal stories as well. You know, we had one lady say she's a senior who just had to pay out $900 for dental work, plus another $1,100 for dentures, simply not good enough. I've paid my dues over 50 years of working and paying taxes. Someone here says, someone who works with vulnerable populations, I see the pain, physical and mental, they endure because they can't afford dental care. The government talks about the importance of mental health, and access to oral health is a major part of this. So people are really recognizing the importance of this as a basic healthcare need that has been so neglected for so long. There's a number of comments. This is so late and coming, but better late than never. We absolutely do need dental coverage here in Canada. So many people suffering with pain, humiliation, low self-esteem, depression, and poverty. There aren't too many employment options for a person with, quote, dental illness, unquote. So we're talking about, the effects on the individual, as their healthcare, their self-esteem, their ability to get work. And all of these things are coming out when people are realizing that and they look at the fact that somebody is out there saying, listen, let's fix this. It should be done. It should have been in place long ago. It's an important part of health. Bad teeth are an important source of general illness. No one should become ill or disabled because they couldn't access dental care. That's another comment from an individual. So, it's a real problem in our province of Newfoundland and Labrador. Our plan would, in fact, benefit almost half of the residents of Newfoundland and Labrador with family incomes of less than 90,000. In fact, our plan is to provide with no premium for families less than $70,000 family income, which would be about half of the province, and a sliding scale for over 90,000. So that would give strong access to dental care. And we've talked to dentists, we've talked to dental hygienists who are anxious to be involved in making sure that people have care. I think this is a terrific opportunity to provide something that people desperately need. We heard from a lady in Nunatsiavut in Nain talking about the lack of dental care availability there, people waiting 2 years to get their teeth cleaned, suggesting that people, if they go south, if they come to the island for some other work or south they should get their teeth attended to then, to leave room in Nain for the clinics when the dentist or the dental hygienist do come. So it's that desperate that people need that, and the service is not available, but there's part of it is a lack of resources, and this dental care plan would assist that in a very important way. The people who need this care are quite often people who are of low income or rural or underemployed. It's a very serious problem, and it's something that I've been concerned about for many, many years. I'm delighted that we've been presenting this both in the last election and now here in the House of Commons. Hopefully we will get the kind of support that it needs to move forward.
Beth, did you have a follow-up?
No, thank you. That's great. Thank you.
Thank you very much. Next, I have Susana De Silva. If you can please identify your media and who you'd like to ask the question to. Thank you.
There we go. Can you hear me now?
Yes.
Perfect. For Mr. Singh, I'm with CBC. Just a question about a story, some information we've gotten from PHAC related to the quarantine hotels over the last couple of days. We've spoken to several travelers who have come in. Some have refused the test upon arrival. Others have simply said, I'm not going to the hotel leaving and not, well, first off, when we've asked PHAC how many people have arrived internationally at the 4 airports across the country and refused to go into hotels, the agency was unable to give us a number. What's your reaction to that?
Yeah, sadly, the quarantining in general, the Liberal government has failed on. And the reason why this is a big deal, and I was speaking with a public health expert about this, is that though the rate of infection from international travel is low, and that's fair to say, the risk is high because we know that variants that are unpredictable, might be highly contagious, can be introduced into Canada through international travel. So while it's not going to mean a lot of infection, it could mean the risk of very contagious variants that throw off all of our modeling. And really what that means is that it could put people in real risk. So we want to see an improved approach to quarantining. It's just been an abysmal failure. From the beginning, the Liberal government's not done a good job of securing the border when it comes to international flights and travel. There is a way to do that. We've seen other countries do it successfully. There are clear ways where we can ensure people are quarantining appropriately and we are reducing the risk of any additional spread. The quarantine hotels are just one example of many where the Liberal government has failed to do a good job of securing international flights in terms of quarantining and keeping Canadians safe.
Susanna, did you have a follow-up? You may be on mute.
There we go.
Yep.
Sorry, as we continue to also to ask some more questions around that and how many travelers, what we've also been able to determine is that in terms of enforcement and any punishment, so to speak, around those who do decide that they refuse to go into the quarantine hotels, there have been 0 tickets issued for anyone in Calgary or anyone in Montreal. Seems to be no enforcement happening whatsoever at those 2 airports for people coming in. How much of a concern is it that there are no repercussions, particularly at those 2 airports, for people who are deciding to ignore the rules?
It's clear that this whole approach of the Liberal government's been a failure, and this is just more evidence about that failure. And really why this is so important, and I just want to reemphasize, it is very important while the Prime Minister will say, and he's not wrong to say, that the rate of infection is low from international travel. Right now, the focus has to be on workplace. That is where the most rate of infection is happening. That is where people are getting sick. And that's why we've been saying to Justin Trudeau, we need to improve paid sick leave. The federal government already has a program. It's not a jurisdictional question. That is a red herring. We have forced the Liberal government to understand that this is a responsibility. We have a federal program. It's just not good enough. And experts have said it needs to be improved. So that's where our focus should be in terms of the rate of infection, or how likely people are getting or to get sick, and how much the spread is happening. It's happening in workplaces. People are going to work sick because they have no other choice. We need better paid sick leave. That's one. But the international travel question is a serious one because it does introduce new variants, and it has the risk of introducing variants that are highly contagious, which might then result in higher transmission down the road. So it is vital that we have a better approach to keeping people safe in Canada with a better quarantining process. And that includes making sure that there's strong enforcement, that it actually happens, and that the process actually works. This has been a failure, and it is sad to say this because we need to do better. So again, I implore Justin Trudeau, do your job. Make sure when people are traveling to Canada that there is a good quarantine policy in place, that people are kept safe. And let's make sure we immediately deal with the urgent threat of workplace transmission by bringing in a better paid sick leave, and let's get everyone vaccinated.
Thank you very much. Merci beaucoup. Just one last call. If you'd like to ask a question, to please use the raise hand function at the bottom of the page. Si vous avez une question, veuillez utiliser la fonction lever la main. Next, I have Allison King with the VOCM.
I was hoping VOCM would ask a question. That's another good Newfoundland and Labrador.
Hello, can you hear me there?
Yes.
Loud and clear.
All right, I can't hear you, but maybe you can hear me, so I'll just go ahead and ask. This is for either one of you, perhaps Jack Harris, since you're local. What has COVID-19 told you about how important a federal public dental care system is, especially when people's financial situations have greatly changed during the pandemic?
Well, what we've seen across the country, of course, is millions of people have lost their jobs. And with that, they've lost their dental benefits and other benefits. And of course, many millions of others never had them in the first place. And so, they don't have access to dental care. This is really important. What we have seen is actually a study done at the McGill University did a study showing that people who have oral health problems, serious gum disease and oral health problems, are far more likely to get a serious COVID symptoms, more serious than others. They're 3.5 times more likely to be admitted to intensive care, and almost 9 times more likely to die from the disease. So the lack of dental care is extremely important, and we've seen that in the during the pandemic. But also, the pandemic has pointed out a lot of inequality in our society. And in the sense of that, we're seeing people recognize that there's a fundamental unfairness here with respect to those who have access to dental care and those who don't. And it affects their health, it affects their self-esteem, and many times the ability to get a job or move forward in life. And in addition, of course, to the pain and suffering and the consequences to their overall health. So it's really important. And where we've seen the inequities in society, some people did very well during the pandemic. Lots of people did not, of course, and they're the same ones in many cases who are also being deprived of adequate health care. And it's something that we think needs to be fixed. And fortunately, I mean, this is the good part. It is something that can be fixed. This is a patchwork, yes, on the way to universal dental care, but it can be put in place for a reasonable amount of money. It's quite doable. And we're asking members of Parliament today to vote in favor of the idea of doing that and doing it right away.
Thank you.
Allison,
No
you have a
follow-up.
follow-up? Okay, great. Thank you very much. I see no more questions. So this concludes our press conference. Ceci met fin à notre conférence de presse. Merci. Thank you.
Good job, Jack. That